We all know what it's like to feel unwell. It might be a physical illness with flu-like symptoms. One type we might not even think about, mental illness.
According to the National Institute of Mental Health, it is estimated that 1 in 5 adults live with a mental illness. We can't do this alone, but guess what? There are resources to help us. Here to tell us more, this is Richard Matthews. He's the Director of Business Development and Marketing, and this is Kristen Oldney, who is a child PHP therapist. Thank you guys for joining us.
Welcome.
This afternoon. It's wonderful having you.
Thank you for having us.
I want to jump into the deep end real quick here. What do you think is the most common misconception about mental health?
I think that there's mostly the stigma attached to mental health.
Yeah.
I think that a lot of people see it as an issue that has been, not looked at for a long time in regards to, that it's not normal.
Right.
And I think that, we are trying to bring more of a normalcy to that, to mental illness, so that people feel more comfortable with that. Because it's important that, people feel comfortable talking about their issues so that we can get them the help that they need.
Yeah, and Dover Behavioral Health is an important resource for folks on the peninsula. Why do you think that is?
Well, Dover Behavioral Health has been around for decades. We're able to deal with a lot of issues, from detox to substance abuse treatment to mental health treatment, and now we're actually working on our new program down in Georgetown. And I think that the important part of that is that we're able to treat adolescents and children more intensively that we did in the past.
Okay, tell me real quick, what is a PHP therapist?
It's a partial hospitalization program.
Okay,
So children and teens come to us after being inpatient to continue getting services that they need and to continue learning coping skills and things to help with mental health issues.
Okay. Tell us more about the Georgetown PHP program.
I am the child therapist there, and I do work with the children 6 to 10, and I help.
6 to 10.
Yes, we do have some children there that are as young as 6.
Wow, I'm sorry, go ahead.
So our program is to help, serve and help them with mental health issues, behavior issues, and we just teach them coping strategies and, to help manage with daily life stressors such as, anger or like anxiety, depression, just to name a few.
Yeah.
We are a group therapy setting, and so we also can help the children learn like social skills and how to interact better with each other and better communication skills.
We talked about the stigma behind mental health. What can we do? What can we teach our children to do to end that stigma?
I think one of the big things is communication. Parents have to continue communicating with their children, to get, we live in a society now where you have a lot of, we're very automated in regards to cell phones, and so a lot of interactions have changed in regards to how people interact with each other. So I think that that's important to make sure we still have those interactions, going back to when we used to have, dinner at the table and the whole family would sit together and have conversations. And I think those are the things that we need more to help to break the stigma and, make it normalized so that people feel comfortable getting mental health care.
Yeah.
Okay, so how difficult is it to schedule an assessment? Can we get an assessment?
Yes, it's not difficult at all. We take walk-ins right at our Georgetown location. There's no wait whatsoever. You can also call us. We have a phone number, 302-747-1421. And we are located at 404 South Bedford Street in Georgetown, Delaware. And yes, we take walk-ins, and there's no wait list whatsoever.
Sounds like something needs to be done, huh?
Richard and Kristen, thank you so much.
Well, thank you for having us.
Thank you.
Good to hear this. Wow.